We've learned already today about the different types of financial trauma. You mentioned there's acute, there's chronic, there's inherited, and there's also financial abuse trauma. We spoke earlier to the cost of avoidance and how important that is and the ramifications of the cost of avoidance. What would you say in your clinical perspective ways that you can break those kind of patterns in
Mhm.
that respect?
I think with any kind of trauma, as scary as it is, the only treatment is to face the trauma, do therapy or the different kinds of approaches, such as EMDR is an approach, or different trauma treatments that we do in. If we're talking about kind of capital T trauma, which I think we are, it becomes so part of our nervous systems and our behaviors and how we behave in the world that if you don't deal with the trauma and work through it and repair those events and reprocess them, then you probably will end up repeating the cycle, like you mentioned. And as you've mentioned, that just puts off or kicks the can down the road in terms of being able to be productive in the financial sense, or even just in your mental health and satisfaction if you're always have a trauma that's under the surface that's really causing you pain.
If we look at some of the symptoms, if you will, of avoidance, a lot of people will dissociate or shut down, especially when we're talking about the topic of money and finance. I find that there is a correlation between people who completely shut down during those types of conversations and people having trauma with the capital T, as you call it. So that really highlights the importance of having that safe environment, always leaning into the importance of behavioral finance, the why behind things, because ultimately the cost of avoidance here is huge if we're just going to completely shut down and not be able to progress through any of the solutions. So I'm glad that you brought that up.